Hi, I'm Trina McClellan, and shortly I'd like to introduce you to one of my colleagues from Women's Health Queensland. If you haven't heard of this not-for-profit organisation, it's a free service available to all of the state's women who may have questions around their health or their well-being. Usually you'd connect to Women's Health Queensland's midwives and nurses and counsellors and social workers over the phone or in person, either individually or in small groups. Of course, thanks to COVID-19, close contact has been out of the question for some weeks now. So the Women's Health Queensland team has switched to using technology to facilitate face-to-face contact. They're answering questions and providing more information and referrals than ever, and even running classes and small groups online. If you make contact, the first voice you might hear is that of Kerry, a qualified social worker who's about to complete her university degree in midwifery. Hi, Kerry.
Hello.
Kerry, what have you found women have wanted to know most about in recent weeks?
So most of the women that I have spoken to are concerned about the effects of COVID-19 on their pregnancy or their ability to access health services.
So what are some of the restraints or constraints that they've felt?
So a lot of them have been too afraid to go out into the public arena, out into their doctors. For some of them, actually, some of their hospital appointments have been cancelled because now it's all over the phone. So they're feeling quite isolated and unable to access the services that they need.
And what are you able to offer them then over the phone?
So over the phone, we offer some reassurance around COVID-19 itself, around all the stuff like social isolation, how we manage that, how we manage accessing our health appointments. We give them, I guess, a sense of it's okay that you are safe to go do your appointments. If you're following all the COVID-19 isolation rules and doing all of those things, that it is okay for you today to be pregnant, accessing your services, and doing what you need to do.
That's brilliant. And what other things have they been asking about?
So some women are actually new to the area of Queensland, and so what they're looking for is services in their suburb or where they newly come to. For instance, a good female GP. Where can they go get their cervical screening? For the women who are accessing our midwifery clinic, some of their questions are about, I haven't been able to access my OB or my midwife as normal, but I've just got a couple of questions around, I'm experiencing this, is this normal?
And Women's Health Queensland is able to give them a lot of that information themselves or refer on, aren't they?
Exactly. So what we'll do is, obviously, we can't diagnose anything, but we can answer some questions or we can refer them in the right direction to get the answers that we need.
That's fantastic. So how has your own background helped you provide women with the information and support that they need?
So I myself am a qualified social worker and I've worked in mental health and a few other fields. So when it comes to things like perinatal mental health, or if someone's experiencing anxiety, depression, all that kind of stuff, which actually has come up a lot due to COVID-19, people are very anxious about what's going on around them. So with that experience, I can offer some, I guess, comfort, some strategy in how to manage that anxiety, how to deal with our ever-changing environment at the moment, because it is constantly changing and people get a little bit unsure about what their next step will be. I'm also this year going to graduate as a midwife, which is very exciting, thank you. And so with that comes a whole bunch of new experience that layers onto my social work. So it means that I can, with confidence, talk to women about their antenatal care. I can talk to women about preparation for their up-and-coming exciting birth. And then, of course, once I've had their baby, I can offer support around the things that I guess you're not really told about, like breastfeeding, your baby that won't sleep, all of this stuff that suddenly we've spent 9 months getting ready to have this baby, but we didn't actually talk about what we're going to do once we have the baby in our arms. So we can offer all that kind of support.
Like what to do with a colicky baby at 2 o'clock in the morning.
Exactly. And you think you're all alone and you think, what am I going to do?
So how does Women's Health Queensland's midwife check-in service work?
Okay, so what we do is sometimes women call us, sometimes they can email us through our website. There is a registration form. We will pick all of that up, we will make contact with them, we'll have that first phone contact where we'll explain the service to them, and that's where it's a regular check-in call, I suppose, as it says, check-in. And what we do is we will organise times that suit the women, so that could be, for some women it's weekly, some women it's fortnightly, some it's monthly, and we'll do it on a day and a time that suits them. So we'll call them, and the calls are untimed. So we will talk to them for as long as they're going to need us to have that chat for whatever's going on for them. For some, it's just they just need assurance that what they're experiencing is normal. For others, they just might have a question. For instance, how do I get my baby to sleep? It could even just be, something simple as they just want that friendly person because they might be isolated, just to have a chat.
Okay, that's fantastic. What about somebody who's perhaps got a more complicated pregnancy or has had a difficult birth?
So when you add complexity into the pregnancy, a lot of women usually already have their medical health people that they will be in contact with, and we always recommend that that is their first point of contact. If something's not quite right or something's not going how they expected, for us, what we can do is we can just walk alongside them as they experience all of that stuff. So it's just that other extra person who understands what's going on and can offer some extra support.
So everyone's life's a bit different. So how, you're saying you can book a time anytime. Does that mean in the evenings or the weekends?
No, unfortunately, we are only Monday to Friday, 9 to 5.
So that's a bit of a trick, isn't it?
It is.
But most people, though, that have just had a baby are probably going to be at home or at least able to have some of the day available to have a chat.
Exactly. So most of the women that I work with, that 9 to 5, Monday to Friday hasn't been a problem. And I will just say, because of COVID-19, lots of people are working from home. So for those people, this has been working out actually quite well for them. So, yeah.
So if I was to be in your check-in program and I had something come up in an emergency, would it be okay for me to check back in with you?
So, for instance, if you've had an emergency and you've gone off and you've seen somebody else, yes, so I've actually experienced that. So one woman I have been talking to, there was something going on. I directed her to immediately make contact with her medical health professional. She was with an OB, an obstetrician, and I said to her, once that's all over, give me a call back, talk to me, and we'll talk through what happened and what was going on for you.
That's fantastic, Kerry. Well, thanks for your time. Would you just do one thing before we go, and that's share the best phone or email address for people to use to get in touch with Women's Health Queensland?
Okay, so the best email address is health@womenshealth.org.au, or we can be called on 1800 017 676. So that's 1800 017 676.